All right, everybody. So thanks for coming tonight to the workshop here at Strive. So team wanted to put on a throwing injury prevention workshop for Coquitlam Little League was the focus. I know you Mac and Yard's straight down the hill here, and we're going to do some work with the Little Leagues at some of your tournaments this year. So we just wanted to make the connection a little bit early and get to know some of you, and then hopefully you can walk away today with something that you can take home to your practices or that you can think about during the year to hopefully prevent an arm injury. So that's the goal for today. Before we get started though, you might see some of us in Strive gear walking around. So we've got Rob in the back corner.
Hey guys.
He's one of our chiropractors here, also one of the clinic owners, so part of the leadership team.
Thanks for coming, everybody.
Yeah. We've got Carly and Aaron back there. So Carly's a physio here, Aaron's chiropractor, also one of the clinic owners here. And then Katie's just around the corner, you might see her too. So they're good. So the whole leadership team's here, so if you have questions, you can ask any of us here. Yeah, so before we start, so part of the reason why I'm really interested in this too and that I want to do it is that I had a lot of background in baseball. So right now I'm practicing as a kinesiologist and studied physiotherapy, just waiting my licensing exam. So I wanted to work on a project while I'm waiting. So I grew up playing for Wally Little League. I know all of you are Coquitlam Little League, so that might not sound so great, but beyond that, I love baseball, so I wanted to do something for you guys. And I played shortstop for UBC for 4 years. I learned some things there about how to prevent injuries that I wish I had when I was in Little League. So hopefully you can take something away that I wish I had when I was your guys' age. If you have any questions at any point, feel free to stop us, and we can answer them as we go. So is anybody not from Coquitlam Little League? Anybody not from Coquitlam? So everybody's here from Coquitlam? Okay, awesome. What about age group? So anybody under 8 years old here? Anybody under 8? Okay, 9 to 10? Anybody 9 to 10? Yeah, we got one. Good. Anybody 11 to 12? Yeah. Okay, so big year for everybody. 11 to 12, nice. And then older than 12? We got the one? Okay, awesome. Sounds good. No Tri-City Thunder here? No? All right, so everybody should have like two pieces of paper with them. So one's a worksheet. It should say should say fill out as you go and take home. So this one here, I explained it to most of you. You don't have to hand it in to us at the end. Just take notes if you like. If you don't want to write anything, you don't have to. But yeah, anything that you can take home, feel free. And then the other one here is a checkout form. So this one, just try to fill it out by the end of tonight. You can hand it in to us. We'll get all of those forms here, and then we'll do a draw for one of the prizes at the end. Some of those prizes include like a free physio or chiro assessment. So if you do get an injury throughout the year and you want to come in and see a physio or chiro, it would be covered. Or there's an injury prevention screen that's run by me and one of the other kinesiologists that will also be complimentary as well. And I'll explain that as we go. So feel free to fill that out if you want. You don't have to sign up for any programs today, but even putting your information down, checking one of those boxes would be enough for that. All right. So has anybody here had arm pain in the past? Any players arm pain in the past? Yeah. Okay. Did you ever have to miss any games because of it? Keep your hands up if you had to miss any games because of it. Okay. So everybody's playing through it. Okay. Okay. Do you remember from those when you had that arm pain or soreness? Was it at the beginning of the year? So hands up if you remember it being early on, just starting back at the year. Okay. Yeah, we got a few. Okay, what about middle of the season? Can everybody remember? Yeah, a couple. And then end of the season, like playoffs, where you're playing a bunch of tournaments, anything like that? Okay, maybe not as many. So some for the beginning of the season, middle of the season. All right, so we'll talk about that more in a bit here, but the goal for today, so we're gonna give some ideas of like what might cause some arm pain or throwing injuries. So what some things to look out for, and then we'll talk a little bit about pitching mechanics. Some of you filled out in your forms that you wanted to learn more about that, so we'll talk a little bit about that. Warm up and arm care strategies. So that will be things that you can do before you start practice, and some band exercises for the shoulder to strengthen. We'll briefly touch on that. Some things to think about post throwing, like do I ice my shoulder or do I not ice my shoulder or elbow? And then we'll talk a little bit about what we're offering for here at Strive as an injury prevention screen. It's optional, you don't have to do it because you're here today, but we'll provide information on it at the end. And then if you get injured, what do you do? Okay. So, does anybody do the Little League pledge anymore? Does that still happen in Little Leagues? Do you line up along the base paths and take off your hats? No, it doesn't happen. Okay, so this might not be relevant for you, but when I played Little League, we had one captain go to the home plate and they had to recite Little League pledge, and everybody else would follow. So basically, Strive's our Little League pledge today. So we're gonna have fun. We're gonna be interactive. So please stop me if you have questions. We welcome participation. We'll hand out prizes for anybody that wants to participate and demo anything here. And we'll give 110% to answer all your questions if you can. Good. And then, yeah, we're going to help you take action today. So we'll provide some resources for you guys that can help prevent injuries. So first question for everybody. Why do we think arm injuries happen? Does anybody have any ideas? Yeah, at the back.
Like whipping your arm too fast?
Whipping your arm too fast, yeah. A lot of arm motion, that can be part of it, right? When you're throwing harder, yeah.
Maybe you're throwing in a weird way, like sidearm.
Could be, yeah. That's definitely a good option. We'll talk about pitching mechanics in a bit. That's great, yeah.
Not warming up.
Not warming up, yeah. That's a big one too. If you go right into practice without doing any warm-up throws or jogging to get your heart rate up, that can be a reason for sure. Okay, those are some good ideas. Why do we think arm injuries happen at the beginning of the season? All right, so a lot of you put up your hand for being sore early on. Why do we think that might happen? And parents can help out here too. Yeah.
Because we haven't warmed up first, and we haven't played in a while, so.
Exactly. Yeah, you nailed it. And do you have anything else, Jordan?
No, I was gonna say
no,
that.
you're gonna say that. Yeah. So you might go from playing a different sport, or you might not have played baseball for a bunch of months, and then you go in and you're doing evaluations, then you're into practices, and then games right away, right? So it's all a lot out of nowhere, where you're just starting something, right? For us adults, right, that could be, maybe I haven't gone to the gym, or I haven't jogged or gone on a long walk for a long time, then you start again and your aches and pains come up. Same kind of thing with throwing injuries. So hopefully today you can take something away that can help prevent that injury at the start of the season. Okay, so I'll fly through these because we're going to talk about them in more depth, but some things to think about is the timing of the season, right? The number of throws that you make in a given game or practice, the intensity of throws, so that could be the velocity or how hard you're throwing it, or it could be how far you're throwing it. So if you're throwing balls from the outfield versus from first base to second base, right, that's a little bit different. The pitch type, so I know a lot of you said that you're pitchers here, so throwing a fastball versus a changeup, right? That might have a little bit different effect on the arm. I'll talk about that. Pitching mechanics we'll go over, and then your strength and your mobility and range of motion, those kinds of things all play a role. We won't go into depth on the things at the bottom there, but sleep is important, so make sure you're sleeping, especially if your arm's sore. Get a good night's sleep is going to help your body recover. Eating well, right? And drinking a lot of fluids. All right, so I'm not going to beat this one to death, but preseason and end of season where there's a lot of games and tournaments, that's often where a lot of injuries come up because we're throwing more than we have in the past or in recent weeks, and that's a reason to have an increased risk. All right, the number of throws. So when we're talking about a single practice, if anybody's a coach here, you want to think of how many times are my players throwing in their given practice. So that could be warm-up throws, right? On the line, out to the base path at the beginning of the day. Then you get into ground balls and fly balls. There's some more throws. If there's a pitcher and they're throwing a bullpen, there's more throws, right? So a lot of these throws add up. And as a volunteer coach, you shouldn't be expected to count every single throw. That's unrealistic. But to be thinking about that when you're making your practice plans, like how much are my players throwing? And then throws over the course of the week. So you got to think of practices and games, right? Extra work. So like I know some of you are really into baseball, which is awesome. You want to go to the field every day. But if you throw every single day, right, our arm doesn't get that chance to rest. So just thinking about that a little bit. Some strategies that you can use. So start of the season, gradually increase the amount of throwing. When you return from an injury, so if you have arm soreness, you go see a physio or chiro, you start to come back to playing. You don't want to jump in and do the exact same amount of throwing you were doing before the injury. You want to kind of gradually ease your way in. And then, if you have a day or practice where you've thrown a ton, or a game where you're throwing a ton, maybe the next day's more of a rest day. So some of that falls on the coaches a bit, but some of that as players too. You can tell your coaches, hey, my arm's super sore. I threw a lot yesterday. Can I take it a bit easier today? So. Intensity of throws. So we talked about that a little bit, but high effort versus low effort throw. So if you're pitching in a game, right? Say you throw 50 pitches. That's a lot of high intensity pitches versus if you just throw 50 balls in practice, like back from taking a ground ball, throwing it lightly to the coach catching it, right? There's a little bit of a difference there, right? So thinking intensity, position specific, right? If you're a catcher and you're throwing balls down to second base all day and to third base all day in between innings, and you're a pitcher too, right? It's a lot of high intensity throws versus if you're playing second base or first base. And some strategies. So after a period of high intensity throwing, say you're a pitcher, you throw 40 pitches one day, right? The next day, so for coaches, you might want to think, okay, maybe I don't put this guy or this player catching at the next game. Maybe I play them at first base or second base or another infield position where they don't have to make quite as many throws. And then practice structure. So say we're getting into the heat of the season when you're playing 3 games a week, 2 games a week. I don't know when it gets. How many games would you play mid-season? Like when it gets busier, or with tournaments, like 3 games. 4 games?
Two regular season and then
2 regular
3 or more during the tournament or summer ball.
Okay. So quite a bit, and you might not practice during that time. But if you do practice during that time, maybe instead of, if you normally have practice, hit ground balls, get players field it and throw back. Maybe instead of getting them to throw back, you just get them to put it in a bucket. Like field the ground ball, put it in the bucket, right? Just reducing the total amount of throws during those busy times can help to prevent some injuries. Okay, pitch type. So this one's often talked about quite a bit, right? Do I throw a curveball? Does the curveball increase my chances of an arm injury?
Yeah.
So a lot of people, that's okay. You can call out. So a lot of people might think, it does increase arm injury, but a lot of the research doesn't necessarily show that a fastball versus curveball is not necessarily going to increase your arm injury risks. But actually a changeup is the best on the arm. So it has it's the least stress on the arm. So if you're maybe have a sore arm or you want to reduce the chances of a sore arm in your pitcher and you want to develop a second pitch, changeup is often a really good pitch to learn because it's a little bit easier on the arm. All right. And obviously you're probably going to throw a lot of fastballs, which is totally okay, which is good. And it's not that curveballs or sliders are bad. It's just keep in mind that if you are pitching and you add a bunch of pitches like curveball, fastball, slider, that's a lot of stress on the arm. That's it for that slide. So what we tried to do to help kind of narrow it down to something that coaches can take and implement right away, we put together a throwing progression plan at the beginning of the season. So for 6 weeks, we put together a plan of roughly how many throws you could make in a warm-up, roughly how far the player should be throwing from when they're warming up. And then if they are a pitcher and they're wanting to throw bullpens, how many pitches can they throw in a bullpen at the beginning of the season? So we built a program. We have handouts here, so any coaches that would like them or even players that would like them at the end, we'll pass them out to you at the end. And it doesn't have to be perfect, right? As a coach, again, you might have games coming up. Sounds like there's games in a couple weeks, right? You might not be able to follow the plan perfectly, and that's okay. It's just a guideline that you can try to follow.
Sorry,
Yeah.
So say if you're not pitching, but then you've done long toss and thrown a lot of balls, it's always, I say, it's probably always good to ice the arm, but at the same time, I know it's not for every single instance, but do you recommend it for every practice, just icing the arm?
Yeah,
If you had
it's a great question because that used to be recommended all the time. Even in the big leagues, guys would throw bags of ice on their arm, but they're kind of starting to go away from that. And part of the reason is that after you throw a bunch, you want blood flow to the area to help heal the area, or like to help the body recover. But when you have ice on that area, it temporarily decreases the amount of blood flow to the area, and it can actually delay healing. So right now, for the most part, most people like in the big leagues or higher levels will actually do an active like cool down where they go for a jog, or they do like light arm exercises, something to like get the blood pumping through that area rather than icing. But it's a good question because I definitely iced my arm a lot growing up as well.
So with, like, for example, J-bands, just you recommend
J-bands would
right
be
after
great.
practice perhaps?
Yeah,
because
it would be really good if somebody's arm's exhausted and you're doing J-bands until they can't do them anymore. That's not great, but even like a light set, like if you like pull them back, we'll give a couple examples today. But just like even if it's 5 minutes or less, it doesn't have to be long, or it could just like be some arm circles or some stretches. Like sometimes the elbow feels tight, just some like stretches here. We'll talk about that a bit at the end, but that's good, really good question, man.
So you're gonna cover like when to ice, when to heat, when to do both?
Well, we'll talk about it. I have something near the end to discuss that. But if you have extra questions that I don't touch on, you can ask them as we go. So this should be a fun part. So I want as much participation as we can on this. So pitching mechanics. I know like there's a lot of people talking about, oh, this is how you should throw, this is how you should throw. There's no perfect way of throwing for performance or injury prevention, but there are a few things that are pretty relevant that you should think about if you're coaching pitching, or if you're a player too. So does anybody know who this is? It's a Blue Jay, or I think he might be a starter, but anybody?
Just thinking Swanson, but.
Pearson? Does anybody know Pearson?
Yeah.
Nate Pearson. So that's him. He has pretty good mechanics. He was one of the guys that they often talk about his mechanics being so good. But anybody know who this guy is on this side?
You.
No. No. I wish. But he played for Kukul and Lily growing up, and then he played UBC with me, and now he's in AAA for the Chicago Cubs. He's with the Blue Jays organization. So it's Curtis Taylor. But I grabbed this one because I know he was always really good at this specific technique. So I want to see if anybody picks up what I'm seeing here. So looking at the stride leg, so the front leg of the little leaguer here versus the front leg of Curtis here. Does anybody see anything? Yeah.
When he steps down, his foot is sideways and stepping forward at the catcher.
Oh yeah, that's a good call. Like the direction of his toe pointing. Is it that way or that way? Yeah. So that's one thing. And anything else with that stride leg? It's kind of hard to tell because they're not exactly the same angle, but okay, I'll show you two ways. So yeah.
When he strides, his like toes on the edge of the. It's like stretching as far as he can.
Stretch. Yeah, that's a good thing. I actually didn't pick that up, but that's a really good one. You want the long stride leg is nice. It cuts down the distance that you have to throw and gets your body involved a lot. Yeah, that's good. Good pick up there.
He's finishing facing the catcher. Another guy's coming more of a post.
That's part of what I was looking for here. So with a little leaguer, where the way he's stepping is he's stepping out a little bit, and then his arm has to come fly through the zone this way. And that's a little bit more stress on the arm that way versus in Curtis, he's stepping like directly forward or even a bit, he's a right-handed pitcher, even a bit towards third base side of home plate, and then he's throwing over that leg. So it's a little bit less stress on the arm and it's more powerful too. You get your lower body really involved in it. So something small, feel free to write it down if you want. It's on your sheet there. So what do you see? Stride leg. Maybe make a note, right? He's stepping onto the third base side of home plate for a righty or the first base side for a lefty. So yeah, that's just the answer. This is an example, right? They're just showing the line down the middle, right? And this pitcher, I don't know who it is, somebody from the Rays, but their foot's like directly on that line or slightly towards that first base side of home plate because he's lefty. Okay, I think everybody knows who this is, yeah? Ohtani. Did everybody get that? Okay, awesome. And then I think this is a college guy, so I don't really know who he is either. But do we see anything different about the elbows?
Yeah, he's got a 90-degree angle on this guy's throwing like those.
Yeah, exactly. Is that what you saw over there too? do you want to say your answer too?
Which elbow was it?
So look at both of the elbows here, right? And then the forearm.
Oh,
Do you
his
notice
is, like,
anything?
up straight, and
Yeah.
the other person's like this way.
Yeah, exactly. Do you want to come up and grab yourself a prize if you want? Yeah,
Woohoo!
feel free to pick anything. Did anybody else? Oh yeah, you answered one too. Feel free to come up here. What was your name again? Braxton. Feel free to come up.
What is this?
It's like a roller, like a massage type roller. Yeah, if you want it. Yeah. Look at that, Rob. Rob just added that at the end. He took the prize. So there's exercise bands here. If you do come up for a prize, exercise bands, water bottles, and then drawstring bags here if you want. Whatever you like. Yeah. All right. So we got the answer pretty quickly on that one. That's good. So the more bend that you have in the elbow here, the more torque on your elbow versus if you're more in that 90-degree angle, it's a little bit easier on the arm. Okay, last one here. Anybody know who that is? It's from, yeah, anybody, yeah, nice, good job, Kimbrel. So in his earlier days with the Braves, but do you notice anything here about the trunk rotation? So trunk meaning like core, pelvis. Any of the kids see it? Yeah, George.
He's pointing his thing straight at the thing, and he's going more like this.
Nice, awesome. So yeah, the little leaguers throwing like this, right? And then Kimbrel is throwing like this, where his torso or his trunk is rotated behind, and then he powers through at the end. So you get way more power when you separate your hips and your shoulders. So we'll get one of the kids to demonstrate this in a second, in a little bit, but that was good. Everybody, you picked up on that quick. George, do you want to grab a prize here? All right. So does anybody want to volunteer? Any players want to volunteer? Yeah? Remind me of your name again? Alex? Come on up. As long as you're okay with lying down on the ground for a second, okay? Do you want to lie down on the mat or the floor? Okay. Okay. So feel free to lie down on your back there. Okay. So you're gonna put a ball here by your ankle, okay, and by your shoulder. Okay. Now can I get you to stand up? So we're gonna test Alex's stride length. So are you right-handed or left-handed pitcher? Right-handed. So I want you to pretend that you're pitching. You want to stand with your foot in line with this ball. And I want you to stride as far as you can forward with that one. Okay?
Steve, right?
So that's pretty good. That's pretty good. Now can you do it with holding, like keeping that back foot position and just reaching out as far as you can? There. Yeah, keep going as far as. Oh wow. Oh, okay. Yeah. Holy smokes. Okay. Yeah. You don't need to work on your flexibility. You're good. So this is part of one of the screening things that we would do if you came in, just to see how far your stride is. And if you have a narrow stride, if you can't step that distance, right, from the foot to the shoulder, that's an area that you could work on with an exercise to get you a little bit more motion. You don't need it. You're good. Okay. The next one. Do we have a different volunteer? Anybody? Yeah. Come on up. Remind me of your name again. Max. Right-handed or left-handed pitcher? Right-handed thrower. Okay. So this one is going to be a lateral or a side-to-side jump. So I'm going to get you to stand here, and I want you to try to jump as far as you can, and then balance on the other leg. Okay. If you have to put your foot down, that's fine. Ooh, nice job. Nice job. Okay. So till about here. Do you want to go back to this line here again? Now I want you to do the same thing, but I want you to try to load into that back hip like that, and then push off as far as you can, okay? Nice. Pretty similar, pretty similar. Do you want to try that one more time? What do you think? Yeah? So this time try to go super quick and then go, okay? Yeah, nice. Very good. That's pretty good, right? A little bit better. So sorry, one more time your name? Max. So what Max did that last time was use his legs more for the power, right? So when you're pitching, if you don't use your lower half, your lower body, your arm has to do so much more work. you're probably not going to throw as hard and increase chances of injuries. So if you use those legs and strengthen those legs, that can be helpful for your throwing too. So that was good. Thanks for coming up. Do you want to grab a prize here?
Water bottle.
Any questions here so far? We're still on time. So any questions before we move on? Okay. Okay, so this part, so mobility and flexibility. So people often talk about, oh, you need to be flexible, right? So mobility is pretty similar, but mobility is like the ability of your joints to move through motion. Flexibility, we often talk about the muscles. It doesn't really matter too much here, but what can you notice from this picture? Sorry, before I get into it, does anybody know who this is? Yeah.
Aroldis Chapman.
Aroldis Chapman, nice. Wow, you're big baseball fans over there, I think. Got it. So, what do you notice about the arm? Here, yeah?
Arms like
Arms way back, right? Like way back. So he's got a lot of mobility in that shoulder, which is common for throwers. We usually don't have to work on that motion too much because we usually have it, and it's good. But that's something that's a part of the body that needs to be mobile, is your shoulder, right? Do you want to feel free to grab a prize if you want? What was your name? Mark? Yeah, good job.
That's like one of the reasons why he throws so hard is because he's got so much mobility.
Part of it, that's positive. He also has like strong legs and uses legs a lot, but that's probably a big part of it, right? What other body parts need to be mobile for throwing? So we got shoulder. Yes.
legs.
Legs, exactly. Yeah, do you know what part of your legs? Like, would you say knees, hips, feet? I heard some hips. What do you think? Hips, yeah, you're all right. Yeah, hips. Hips need to be mobile, right? You need to get power into that leg, you need to be able to move the hips. So part of the injury screening that we do here is involved in seeing the hip motion, right? If the hip's limited, maybe we can work on increasing motion in that area. One more body part. Okay, let's go here this time. Yeah, go ahead. Shoulder, we already got shoulder. Mark got that. But elbow, don't necessarily need a lot. Like, we need enough, but there's one other part in the middle of our body. Does anybody know? Yeah?
Core.
Core. Yeah, I'll give it to you. If you want to grab a prize. Remind me of your name again? Jace. Okay. So core, but especially like your mid-back needs to be mobile. They call it your T-spine or your thoracic spine, but that middle part of your back needs to be able to move.
Does the extension of your chest help with the torso? Like, because I see obviously his chest is facing obviously the hitter, right?
Yeah, for sure, a little bit. So and it looks like the chest is going out, but that's like the ability of your upper, like mid to upper back to move. But you're exactly right. Like, you need that motion to throw. And a lot of us young athletes have that mobility, which is good. But it's something that, especially as you get older, you might have to work on that a little bit more. So yeah, you got all the answers there. So if there's limitations in those areas, so if you don't have much movement in your back or you don't have much movement in your hips, right, your body is smart. It's going to find a way to throw the ball. So it's going to compensate in some way, and that might increase the chances of injury. So that's why motion in that area is important. Okay, strength. So for strength, what areas of our body need to be strong to throw? Yeah, let's go here.
Your legs.
Your legs, yeah. Come and grab a prize. And remind me of your name? Kessler, that's right. Was it named after Ryan Kessler by any chance? No.
Everybody else.
Okay, really? Sorry that you. So legs have to be strong. That's awesome. Anything else?
The wrist.
The wrist? Possibly, yeah. Yeah, your wrist has to be fairly strong. Yeah. Forearms can be strong, yeah. And for hitting too, like strong forearms can be really good. Anything else? We mentioned them already in the mobility. So legs is one, yeah. Shoulder, exactly, yeah. Come grab a prize. What was your name, bud? Ryan? Awesome. Okay, one more. Somebody mentioned it exactly. Yeah, let's go. Jason. Core, exactly, yeah. All right, you already got a prize, right? Nice. Good participation here. Really good. Okay, so yeah, leg strength. Shoulder. So shoulder meaning not just out here, but also your shoulder blade. Like those work closely together. So those are important. And then your core. Yeah. Again, if you're weak in certain areas, your body's smart. It's going to try to find other ways to do the job. Right? Might lead to some injuries. So warm up. So this is one of the other pieces that we really tried to focus on, and we'll send out for anybody that signed up yes on the newsletter. We'll be sending out a warm up to go through with video links to different exercises. But dynamic warm up is important. So does anybody know what a dynamic warm up means? Anybody? Dynamic? Yeah. Stretch? Yeah. Exactly. That's part of it. What would be different about a dynamic versus a static warm up? We might need some coaches in this one. I don't know. Dynamic or static. So which one? What looks like a dynamic warm up to you? Like doing some jogs with some arm circles versus just like holding your arm across. Which one looks more dynamic? The running one. Yeah, exactly. So really good. So we want to get our heart rate up. We want to get our body moving. That can like get all of our joints moving rather than just kind of holding one spot. We want to loosen everything up. And then you might do some specific warm-ups too for the shoulder, right? Shoulder needs to be mobile. But shoulder's usually pretty mobile, but maybe we do a couple things to get it moving a little bit. The hips are often important too, and then that upper back that we were talking about before. So that's part of that warm-up thing that I'll send out with more details. And then some banded shoulder exercises. All right, so can I get somebody to demo shoulder exercise for me? Yeah, come on up. Right-handed or left-handed?
Right-handed.
Right-handed, okay. So this one here, do you want me? I'll show you first and then I'll let you try, okay? So you're gonna be standing away from the pole so that you got some tension in the band. And then you're gonna pull your arm back just like that throwing motion here, and then you're gonna slowly control it down. So you're gonna pull up and control it down. Do you wanna try it? And you don't have to have this type of TheraBand. Somebody mentioned J-bands. J-bands are great. So do you wanna give that a try? So elbow, so can I get you to bring your elbow in line with your back? Yeah, exactly, you got it. And then can I get you to do this motion here? Good. It's hard, there's a lot of tension in that band. Do you wanna step a little bit closer to the band? Yeah, good. And then, so arm here, good. Nice. So this is probably a little bit too much in that band, but that's right. That's kind of the motion that you're looking for, right? Trying to keep that back tall and just moving through that shoulder.
Yeah.
All right? Good work, good work. All right, and then one more. So does anybody else want a demo? Yeah, we'll have you back up here.
Just keep them up.
Just, yeah.
I like that one.
Okay, so this one here, I want you to try to put the bat across your shoulders, and you're not going to move your shoulders at all. I want to see how much you can rotate your hips. Does that sound okay? So yeah, across, good. And then try to rotate the hips without moving your upper body. Good. Yeah, you're doing it right. Yeah, exactly. Like rotating back and forth. I know it looks kind of silly, but so and this could be part of a warm-up drill or something that we work on, because when we're hitting or throwing, we want that hip to be able to move first, and then that builds up that power and that tension in the middle of our body, and then we can whip the arm through or whip the bat through if we are able to dissociate those movements. And it's hard. It's a hard movement, right? That probably felt weird. Okay. So can I get you to get back in that same position? You're gonna be in like that ready position. I don't want you to move your legs now. You're just gonna move your upper body. Good. And then back the other way. That looks a little bit easier, hey? So your upper body moves really well. The lower body is something that we could work on, right? Being able to control that. All right, good work. Thanks for jumping up here again. Okay, any questions so far? No? Still following?
What's a question for you?
Yeah.
For young hitters, like that's what a lot of I see is like the younger kids.
Yeah.
They're not using their lower half.
Yeah.
What's a good like drill? Like I know there's drills, but what's a good way to really get them to focus on it? Because I know they had a lot of them struggle at that.
It's super
And
super
same with
hard.
pitching too, right?
It's a great question. So you can do the same kind of drill for hitting and pitching,
Yeah.
but think about like a step back to swing. So it would look like if with the bat, right? If you're here and you're doing like front toss or off a tee, you could get them to step back, load into that back hip, and then fire through. Or if you're pitching, right? Same thing. If I'm a right-handed thrower, I can jump back here, load up, and then throw. So it's just like it's one easy movement that you can think about.
Yeah.
Cool. All right, post throwing. So this is some of the questions that came up earlier a little bit. So first things I have on that list is cool down jog. So this could be something implemented for the team as a coach. Like it could even be like doing a pull back and forth, or like 5 light jogs back and forth from like the baseline to second base, just to like cool down the body a little bit, or light band exercises. So if you have bands, if you have J bands, TheraBands, whatever it is, you can loop it around the gate. You can do a couple exercises, something to just get the shoulders moving after, but it doesn't have to be a lot. Like you don't have to spend, again, more than 5 minutes on this, just something after. And then generally if it's just arm soreness, even arm injuries, usually not recommending ice. That's not to say that if somebody, like if you see a health professional and they're like, you should use ice for this particular injury, and they give you a reason why, you can still follow their advice. But generally as like a preventative thing for arm injuries, they're not really recommending it anymore. So they're almost kind of they're not necessarily recommending heat. I mean, you could, but that's not necessarily, they're more recommending like movement, gentle movement. Like some of I don't know if anybody knows Trevor Bauer or have heard that name, but there's this new device that he kind of, I don't know, helped market, I guess, but he just puts it on his arm after, and it's like stimulation, so it pumps the muscle after. So it's just a way to like get more blood flow, and clear things out rather than icing. Any questions with that? Because I know that was
I remember when I used to play, they would say you go for a run after you pitch, but then you would ice it after, so you would.
Yeah,
now, like,
you
they're
still
saying-
run
Yeah,
after.
but the ice is kind of.
The
gone
icing,
away.
yeah,
Doesn't
they're
really
kind
do
of
much.
going away from that, but it's more of like an active recovery.
It's just more for getting swelling down and that nowadays.
For
an injury,
possibly for
to get
swelling, or to
swelling
help
down.
with pain even. Like it can just be a way to like almost numb the
Numb the
area
pain a
out
bit,
a
yeah.
little bit. For swelling, potentially, yeah, potentially it could help a bit. But also like if there is a lot of swelling, like elevating the arm, even movement can help with swelling as well, because that gets the muscles pumping and that pumps that fluid back to the heart. So it can, yeah.
We have a pulley system.
Pulley system, yeah, that would be a good way.
Range of
Yeah,
motion and
yeah,
It's easier on the arm.
yeah, that's a good idea too. Nice. Oops. Okay, so what did the workshop was partly what we wanted to do to help prevent injuries, but we wanted to provide some other opportunities as well if you wanted to go beyond that. So how do we reduce the injuries? One of them is gradually building up the amount of throwing and intensity at the beginning of the year, which we touched on, right? So we do have, for any coaches or parents or players that want to take them home, we have about 10 here that is just, there's 4 pages and or 2 pages double-sided, just with like a week-to-week throwing progression that you can take home. So I'll leave them here at the front. Feel free to grab them, or I can hand them out at the end as well. But that's the first thing that we want to provide. And if you have questions about it, feel free to let me know. Rest days after big throwing days, so no resources for that, but just think, okay, if you threw a lot one day, rest day or less throwing is probably good the next day. Effective warm-up and cool down, that will be sent in an email of strategies for warming up, cooling down. If you haven't, I know most of you selected yes, that you could sign up for the newsletter. If you selected no, but now you're like interested, like, oh, okay, maybe I would benefit from that, just on that quick action checkout form, at the very bottom, there's a section that says newsletter. So if you're interested in any of those resources, feel free to check that box there, and then they'll be sent in an email. And then injury screen, so I like kind of touched on it as we went, right, with that stride, that lateral jump. We'd look at range of motion of the shoulder, we look at strength of the shoulder. That's something that we're offering here, ran by kinesiologists. There would be like an hour, 1 hour session. We'd go through a bunch of tests. Then at the end of the test, we'd see like, okay, is there any limitations or any weaknesses that we could work on? Then we'll give you those exercises. Then you can take them home. You can do them as much as you want at home. But if you're like, hey, I need more guidance with this, then we're also offering like 30-minute follow-up sessions where you can come in one-on-one with a kinesiologist. We'd work in here, go over like technique to make sure you're doing it right, and to give any feedback that you might have. So that's an option here too. That's that second piece here. So the goal with that is mainly to reduce injury risk. That's the main thing. But the secondary goal would be performance improvement too. So it's just a way to possibly increase arm strength, increase leg strength, get everything working together a little bit more. That would be the target of those last two programs. Okay, we're almost done here. So this is the same thing that I just talked about. But for those specific exercises that I talked about, where we're supervising the exercises, we would offer them either just like a one-off if you wanted to come in for one supervised session, but if you wanted to go like 6 session, we're offering a package for a discounted rate if you wanted to get more consistency as well. We'll stick around to answer any questions if you are interested. Okay, now if you do get an injury, what do you do, right? So there's so many health professionals out there, it might be hard to know like, okay, where do I go to get assessed? But first, like, how do you know if it's time to go get checked out, right? Arm soreness happens a lot throughout a year. Do you go see a physio or chiro every time that happens, right? That's a question that people might have. So if you do have some arm soreness, you just have it for one day, right? You feel pretty good the next day, you're back to normal. That's probably not a reason where you'd have to come in. But if you're noticing arm soreness like throughout the week, or like it goes on for longer than just a practice or a game, it's a good idea to get it checked by somebody, because that's a warning sign that an injury could come up, right? So if you have arm soreness, you're trying to play through it, you're trying to throw pitch with an arm soreness, other things might come up along the way. So yeah, that could be a reason to come in. And who to book in with. So if you need to see like an assessment, physiotherapist or chiropractor would be the best bet to get fully assessed about the injury. And then kinesiologist and massage, RMT is registered massage therapy. Those are other options that could help with the treatment plan. But usually that first visit, physio or chiro, could be helpful. And again, you could go, like if you have a physio or chiro that you're already going to and you want to keep going with them, that's fine too, but it's that would be the first line of action there. All right, so that's everything like content-wise that I'm going through, but any questions about anything? And feel free to fill out those forms as you're going to. Yeah, questions?
Just in terms of weight training as it relates to both strengthening and injury prevention, because generally if you got some, bulk on you and some muscle, that can also help protect things.
Yeah.
Like Steve Proborski, for example, tore his ACL, but he had lots of muscle mass to give that protection for him, right?
Yeah. It can help. Like strengthening is really important. Yeah, it can help prevent injuries, but just doing general strength training, like doing a bunch of bench press, doing a bunch of like heavy squats, is not necessary.